So my name is Elizabeth Gurnt. I'm a product director with CounterTools. CounterTools is a nonprofit that works with partners across the country to advance place-based public health by implementing and enforcing policy systems and environmental changes that promote health equity across communities. A lot of our work aims to reduce the detrimental impact of unhealthy substances, such as tobacco and alcohol, at the consumer's primary point of exposure and access, the retail environment. We are hosting this local control webinar series in collaboration with the Geographic Health Equity Alliance. The Geographic Health Equity Alliance, or GEA, is a CDC-funded national network dedicated to reducing geographic health disparities related to tobacco and cancer. GEA provides free training and support to state tobacco and cancer control programs and their partners on how to reduce health disparities and improve the health of communities across our nation. I encourage you to visit their website, geohealthequity.org, to learn more, and you can subscribe to their monthly newsletter, which will keep you up to date on their latest webinars, trainings, and other resources. We know that local governments are on the front lines of adopting laws and policies that have the potential to improve health outcomes and reduce inequities, which is why we've hosted this local control 3-part webinar series to equip attendees with an understanding of why local policy solutions are so important, the lessons learned from local policy implementation efforts, and our last webinar allowing us to learn about some innovative policy strategies that were built at the local level. So this is the last webinar in our series, but you can find recordings of the previous 2 sessions at geohealthequity.org. You'll also be able to access the recording and slides for this webinar on GEA's website in the next couple of days. So I'm sure that everyone's really familiar with webinars at this point, but I will just use this slide as a reminder to please add your questions for the presenters to the Q&A box rather than the chat, so we can just make sure we keep up with them and get all those questions answered at the end of the presentation. Feel free to add questions to the Q&A box as they come up throughout the presentations, and we'll be sure to save them for our speakers after we get through all 3 presentations. We'll have a Q&A session at the end. So now I'll go ahead and introduce each of our 3 speakers. First up, we'll hear from Kathy Durbin. Kathy was appointed as director of the Montgomery County Alcohol Beverage Services in May 2021, which in addition to its regulatory role serves as the wholesaler of beer, wine, and spirits and operates 27 retail beer, wine, and spirits stores. She joined Alcohol Beverage Services in 2002 as a community outreach manager. In 2005, she accepted the position as the division chief of licensure, regulation, and education. In her role as director, she continues to be an active leader as the VP of the Maryland Alcohol Licensing Association and as a member of the National ABC Association Board of Directors. Kathy was recognized in 2016 by the National Alcohol Licensing Professional Association for innovation and leadership, and in 2017 by the Center for Alcohol Policy as Alcohol Regulator of the Year. She is considered an expert in the field of alcohol regulation, education, and policy. Kathy is a graduate of the University of Maryland in Baltimore and resides in Silver Springs, Maryland. Our next speaker is Stuart Burlow. Stuart is a government relations regional lead at the American Heart Association based in Washington, D.C. In this role, Stuart oversees government relations and advocacy for D.C., Maryland, and Virginia, and serves on the association's field advocacy leadership team. Stuart has been at American Heart Association for 8 years and previously led policy and programmatic initiatives at the Association of State and Territorial Health Officials, National Business Group on Health, and community-based coalitions. Stuart has degrees in public policy and public health from the University of Michigan. And then our final speaker today is Holly Scheider. Holly has 30-year commitment to facilitating social justice and health equity. She has been a leader in Bay Area sugary drink tax campaigns, coordinating outreach for Berkeley's 2014 First in the Nation tax and managing Albany's campaign in 2016. She provided the campaign with strategy and messaging, community outreach, and voter mobilization. She has been a commissioner on the Berkeley sugar-sweetened beverage product panel of experts since it began in 2015. Holly collaborated with Center for Science of the Public Interest to enact the nation's first healthy checkout ordinance. Her leadership included assessing Berkeley's readiness, strategy, messaging, recruiting, and guiding community partners to conduct focus groups and petition signatures. She has also coordinated tobacco policy and media programs in Contra Costa and Alameda County. We're excited to hear from all of these speakers. So without further ado, I'll hand it over to Kathy to get started.
Great, thank you. So thank you to CATCA, the Geographic Health Equity Alliance, and Counter Tools for inviting Montgomery County Alcohol Beverage Services to participate in this webinar. Appreciate you. Next, I'm sorry, I'm going to have to say that throughout because luckily Egress is my helper. Thank you for being my assistant and helping me with these slides. So Montgomery County, Maryland is the most populous county in the state of Maryland with over 1 million residents. Just to give you a little snapshot here, we're adjacent to DC, Washington, DC. And in 2021, Montgomery County was reported to have 4 of the top 10 most diverse cities in the United States. Next, please. So first, let's talk about alcohol, because history matters. We will begin with a historical perspective. To the early European settlers, alcohol was a social institution, a medicine, and an actively traded commodity. Yet it also presented problems for individuals and communities. The complicated relationship with spirituous beverages traces back when the Pilgrims quarreled over the crew of the Mayflower over who had the right to drink the final allotment of beer. Considered medicine in Europe, where much of the water was polluted, alcohol was consumed at all meals, generally in moderation. In 1630, the Puritan first ship, Arabella, carried 10,000 gallons of wine and 3 times as much beer as water. Colonial Americans drank nearly 4 times the alcohol than Americans do today. Next, please. So the roots of what later became Prohibition began in the 19th century with the temperance movement, principally among women who protested against the abuse of alcohol and how it caused men to commit domestic violence against women. This illustration, published in the newspaper in 1874, shows women gathered in protest outside a local saloon. Several states and localities voted to go dry, as banning alcohol was thought to be the solution to the alcohol problem. Conflicts between the wets and the dries dominated the political scene. It was an all or nothing debate, as there was little discussion about regulation. In late 1917, Congress passed the 18th Amendment, and it was ratified in January 1919. It went into effect 1 year later, and Prohibition lasted for 13 years. Next, please. So as mentioned in the previous slide, the struggle to balance alcohol regulation and licensing continued, leading to Prohibition, banning the manufacture, sale, and transport of alcohol beverages. Next, please. So Prohibition solved some problems but fostered others. The pros was it did eliminate public order issues and reduce social problems, and it appeared to reduce drinking levels. The cons, nationally organized crime syndicates developed to supply alcohol. Illegal retail outlets called speakeasies sprung up to accommodate drinkers, and enforcement was weak, and some states did little to enforce the law. So the result was that Prohibition was repealed, and the 21st Amendment gave states the primary responsibility to regulate and tax alcohol. Next, please. So out of that came 2 systems of regulation in the US. The control system, where the state owns part of the alcohol business, and the license system. Private owners sell alcohol at both retail and wholesale levels. Next. So in 17 states and jurisdictions in Alaska, Maryland, Minnesota, and South Dakota, they adopted forms of the control model. 13 of those jurisdictions also exercise control over retail sales for off-premise consumption, either through government-operated package stores or designated agents. Control jurisdictions represent approximately 24.7% of the nation's population. In Maryland, the state went to the jurisdictions, and although I'll be focusing on Montgomery County today, Every jurisdiction is a little bit different. It is important to identify what works in your community. After assessing your community, you assess it again. Like most things today, the alcohol world changes rapidly, and we must remain flexible and relevant. Two words normally not used in alcohol regulation. Many of the strategies used in our community are a direct result of being controlled jurisdiction. Some are shared with other licensing agencies, but all are driven by data and the health and safety of our community. Next, please. So alcohol beverage services in Montgomery County is the wholesale of beer, wine, and spirits for the county, for the entire county. We have approximately 500 employees in our department. We operate 25 beer, wine, spirits stores and one spirit only model. We manage alcohol licensing, enforcement, and education for over 1,100 businesses and generate nearly $300 million in the past 10 years. Next, please. So where does the money go? Some jurisdictions, they do a little differently depending on how much money is actually put into the general fund, but to us it is deposited directly into the general fund. We do not earmark the money here in Montgomery County, but it is used to support services such as fire, rescue, and police, and they help with the tax base. Next, please. Thank you. So our retail stores, tell you a little bit about them. They have built in, as many of the environmental strategies that are built into control systems, they have limited hours. So all the liquor stores in our county are closed by 10 p.m. at night. The products in the stores are, constantly changing. As I spoke about before, times have changed. People want a hot product and then it goes away. But our products mainly really reflect the diversity of our county and our community. We do support local businesses through our stores. So if a licensed establishment, for instance, doesn't have the budget to purchase a case of a certain product, they can come in through their account and actually purchase from our stores instead of foregoing the delivery services. We also support local manufacturers. I believe we were instrumental during the pandemic to help the local manufacturers and local products in our stores and make sure that they were on the shelf so that they were available to folks. If not, some of these producers would have gone out of business. Also, we support the community and try to do as many events as we can. We do have a Maryland Made program that we refer to, and it's a beautiful program and it really does a great job for the community. Next, please. We also support community events, and they've grown in popularity as people find their budgets shrinking. We do a lot of partnerships with fundraisers in our stores. It's mostly driven by, the change that's might be left over, and it's just rounding up to the next number. But so we have supported women and minority businesses, cancer research, and our local animal shelter. Next, please. So licensure, regulation, and education is a big part of what we do. Once a entity applies for a liquor license in Montgomery County, you become part of the ABS network. So it's not just about having the product or having the product delivered to you. It's about training, education, and helping to adapt policies. So we actually work prevention through licensure, regulation, and education. Our pre-licensing program, as soon as you come in or reach out to us and apply for a liquor license, you're part of that wraparound service. So we work with you on any type of relevant laws or alcohol policies. We have a program called ALERT, which is the Alcohol Law Education and Regulatory Training. This program is free and people can take it as many times as they want. And it's really complements the state certification. In the state of Maryland, we have over 20 approved state responsible beverage trainings. So what this does is really brings it local It helps the businesses understand what they can do in Montgomery County and in the state of Maryland, as far as promotions or types of events that they might want to do in their businesses. We also want to work with those businesses to make sure that they are asking for the right type of license. There's now 36 different types of alcohol licenses in our county alone. Some states I know have hundreds now. There's 4 different types of theater licenses, for instance. So we want to make sure that people understand what they can do and they apply for the right license. So the alert training can be taken anytime. You can take it 10 times a year if you want, if it was something that you didn't understand or something you needed assistance with. We also provide the training in different languages. We now do it virtually almost all the time, but hopefully we'll get back into the community soon. The alert training also and the pre-licensing program helps to set people up for success as far as preparing for their board hearings. We support the Board of License Commissioners for Montgomery County as well. And so people have to go in before that board to be granted a license, an alcohol license. And if there's a violation, the board now, it's took a few years, but now the Board of License Commissioners also mandates that the alert training is taken again by that staff. And again, it's free. The FYI program is something that we wrote into law recently, the last couple of years. When the bill was passed, it was really set to help people in their first year. So the first year intervention program is where an inspector, community outreach inspector, will go out and meet with the business, make sure they're on track and that they're see if they have any questions. So besides the regular routine inspections, these inspections are held quarterly, and they're really more like interventions to help folks if they have any questions about their license and increase the mandates that are required by the inspectors as well. Next, please. So as a business resource, we have lots of programs. These are just a snapshot of some of them. We take it personally is also in various languages. I don't know if you all can see very well, but this represents different police enforcement and enforcement agencies. They're on the back of every one of our trucks, our delivery trucks. So you'll see them driving around Montgomery County, and they really do encourage people to plan a safe ride home if they're going out that night. And there's also QR codes on the back of the truck so people can find out more about the various programs in the county that can help people plan a responsible evening. We do work closely with Sober Ride, which is the Washington Regional Alcohol Program, and they have rides available during holidays, most holidays during the year. So we work closely with them to offer them for businesses and let the businesses know when that program's occurring. We also have a retail calendar. I have one right here. It's too blurry, can't see it. But anyways, we've done produced a retail calendar for the last 15 years for the businesses. It's also online, but it has a born on date for tobacco and alcohol on the bottom of the calendar. The businesses love it. They hang it for all their staff to see. And every month is a different alert for them. So it tells them when the board hearings are, when there's the regular alert trainings and how they can register. It talks about what might be something that we're looking for that time of year. For instance, during March, we start our annual renewal process for licenses. So it gives them all the information on that front page. And so this is available online as well. And the businesses, every time we think we can stop doing it, we can't, because the businesses love it. And all of this has been achieved through awards or grants. So it's never come out of our budget directly. It's something that we've done just as a courtesy for the businesses. And whenever we can find extra money or partners, we make sure we have this calendar available. We also run a lot of mystery shops, working with the Responsible Retailing Forum over the years. The mystery shops really do all kinds of things. We've had mystery shops that are available for the businesses, just to check to make sure they're actually, for instance, reading the ID properly. They're putting it in their hand. They're looking at it. Different things that we test for, and we make sure that there's some sort of incentive programs for the businesses. So the individual, if they check it properly, will get maybe a $25 gift card or something as an incentive for people to check IDs. We usually find some of the issues, and if we're looking for something we see prevalent that's going on in the community, we'll run the mystery shop on that issue. We did them during the pandemic. The pandemic was for the carry out by the drink. We tested businesses to see if they were actually serving the drinks in a closed container that's sealed, and we also checked to see if they were carding, or if individual was ordering by phone, what questions they were asking. So we tested them on several fronts, and then also we wanted to know what people were actually selling and serving to people. And this was during the state of emergency, so we did a kind of a snapshot so that we can look at that data and educate our businesses on how to do better. Unfortunately, we found that over 60% of the businesses were not carding properly at that time. Of course, people were desperate and they were trying to make the sale. So, but having that information helped us to create programs around it and to help educate our partners. Next, please. So this is another example of some of the programs we did. This was during COVID, and working with industry. Breakthrough helped us when we were trying to figure out ways to help the beer and wine stores identify people coming into their stores in a safe manner. So this was like the 6 feet distance requirement. So they helped us create, and they created these stickers for the floors, and our community outreach staff went in and worked with the businesses to help them so that they can sell their products in a safe manner, also checking for IDs and those kind of things. But this was a really great way to get in the door and to help people keep people safe during this time. The locals, we worked with the manufacturers to produce hand sanitizers and make those available. We purchased them as well for our staff and whatever we could do to help the community. So that was a great collaboration where many of these producers, again, would have probably gone out of business. And then we worked with Brown-Forman, and we still do on this program, Pause Until You Get Home. Our state still allows, and probably, I would think would continue to allow, maybe, the carry out by the drink. It's a sunset provision at this point in Maryland. But if there's a sealed container, this sticker goes on top of the container just to remind people, not to open that product until they get home. Next, please. Thanks. And then back to the shared strategies. So what we share the I Take It Personally and We Take It Personally program with not only the police, but with the businesses as well, bartenders taking it personally to serve responsibly and to check IDs and to not overserve or serve somebody they believe to be intoxicated. Also, our compliance check program is very important to us. We actually have made that part of what we do. We do not wait for any extra money for our compliance check program. Our alcohol program is, we conduct at least 400 checks annually in tandem with the police, with the exact same protocols every time. We've had a few hiccups during the pandemic, of course. Many of the businesses were closed, so we're just picking this up again. But this is a direct relationship with the alert training too. So the compliance check program is something that we do every year. It's actually put into our county step measures for our program. And then tobacco as well, not quite so many checks, but the tobacco for sale and sale of products in our stores that are allowed to, the beer and wine stores that are allowed to sell tobacco products as well. Our Safety Alliance is actually it's a I would say product of the Responsible Hospitality Institute. We do look for models whenever we can find them. We've had a safety alliance in Montgomery County for almost 20 years. And it's really formed as a result of an issue. We were having problems with fire code violations, and there not being enough sprinkler systems or the right sprinkler systems in some of the businesses at one point. So the fire and rescue were the lead in their safety alliance, and we pulled together and we learn it's liquor, it's, you know, the liquor inspectors, it's people working from permitting services. We pull together as an alliance. We also did that during the pandemic as well. We had a safety alliance that were going in and checking on businesses, helping them with the distance requirements, the mask requirements and such. And then Cops and Shops is an old program, but a great program. And that's where the police will come into a business that is having some issues or feel like they need some assistance. Either they're being plagued by underage folks coming in, people under the age of 21 and trying to purchase products, or there's some other reason. And we also work the liquor inspectors as Cops and Shops. So there's lots of programs. Throwing a lot out there right now, but just kind of skimming over some of them. And I'm really excited to share them with folks and understand that some of these are, because we are a control system and very organized about a lot of what we do, but it's also working in partnership with industries and other partners. Next, please. So finally, just check it out. If you want to learn more about liquor control, please pick up this book, Towards Liquor Control. It's a great book, a great read, and at least something that I love to read about. And you will understand a little better about the history and how this all came to be. I'm always available to you know, just brainstorm with folks. These websites are great websites. The National Alcohol Beverage Control Association, the first one, they're awesome. And that's really our resource for many and almost everything that we do. And we have PamAction.com, which is really talking about Pam Erickson. She's incredible. And she was an alcohol regulator a while back, but has been working on so many community projects and alcohol regulatory systems. SociableCity.org is the Responsible Hospitality Institute, really great community-based organization. Center for Alcohol Policy, and then of course here at Alcohol Beverage Services. Please, please don't hesitate to reach out. And I think my direct email is on the next slide. Okay, so that's it, but thank you all very much. I just threw a lot out there, and there's a lot more, but happy to answer any questions when the time comes. Thank you.
Go ahead, Stuart. We'll pass it over to Stuart.
Great, let me get this set up. Okay, does everything look okay? Okay, great. Well, thank you so much. I guess we're going to sort of switch gears a little bit, move and talk about a little bit different issue, talk about some nutrition policy that we worked on, staying here in Maryland, though, in Montgomery County. And then also, I think, switching gears a little bit and talking a little bit more of the process and the approach that we had in advocating and supporting for this particular policy, really looking in particular at why we landed on a strategy of looking at local policy rather than doing something at the state level, and this particular effort that we were focused on. So again, we're going to be talking about, hopefully most of you are familiar with the concept, but I'll walk through it on the next few slides. We'll be talking about making restaurant kids meals healthier, the work that we've done here in Maryland. So just kind of showing or walking you through a little bit of what this is all about for those of you that might not be familiar with this issue, which is sort of an emerging thing. As I said, the idea behind this is pretty simple and straightforward. We just want to make restaurant meals for kids healthier. not force anything on people, not tell restaurants what they can or cannot do, but really make the healthy choice the easy choice that we've all heard so many times, and create more options for parents or anybody else who might be taking kids out to eat. And we know certainly that the data before the pandemic, and I think we're getting back to that, obviously, showing people and families eating out at restaurants more and more often. We know how much a part of life that is, just picking something up on the way home from work or whatever else. So we want to make sure that in those rush times, that hopefully there's at least something on that menu a little bit healthier. So these efforts began around the country, often as they do on the West Coast, and sort of has hopefully moved out here to the East Coast. Began with looking really just at the beverages on kids' meals. And this was an effort, we call it the default beverage. So if you go to a restaurant, there's a bundled kids' meal. And when I say restaurant, this could be fast food, it could be a sit-down restaurant, it could be anything in between. Any restaurant that has a kids' meal. And so several years ago, looking back in 2015, 16, 17, it started with making an effort to make what we call the default beverage healthier. So if a kid's meal comes with your choice of drink, let's make the options on the menu water, milk, and in some places 100% fruit juice. No, if a parent or anyone else chooses to purchase a soda or something else, they certainly can do that. It's just making that default beverage the healthier option, just as that nudge or kind of that visual cue to say, okay, I see on the menu these are the three options. I'll order one of those. But again, it's not telling any restaurant or anyone else that they can or can't sell or purchase anything else. So this effort again began with the beverages, and Baltimore here in Maryland was the first place on the East Coast to pass such a policy back, gosh, I think it was 2017. I hope I don't have that wrong, 2018 maybe. And a lot of other states cities and a few states have gone on to pass similar default beverage laws. And we said, okay, that's great, but we need to address the nutrition standards on kids' menus as well. If we're only addressing the beverages, we're only addressing part of the problem with all the sugar in drinks that could be on the menu. And so we decided that we were going to make that effort to address the food as well. And I'll kind of get into the particulars on other slides. But again, not restricting anything, not preventing anything from being sold, simply making sure that there's some more, let me go back, a few more options available. And the nutrition standards we're talking about are based on kind of the dietary guidelines for Americans, the typical federal and other nutrition standards related to all the usual stuff, calories and sugar and sodium and fat and so on. But also, mixing in some industry standards as well. And we'll get into that in a minute. As I said, there's dozens of these beverage policies around the country. A couple of states have done this, but only 2 places in the country have included the food in these standards as well for restaurant meals. Montgomery County, Maryland, which you've heard about before from Kathy, and then the neighboring county, Prince George's County. So Kathy talked about kind of the demographics here in our area, so don't need to go through this again, but just to reiterate what Kathy said, looking at Montgomery and Prince George's, and hopefully you can see those on the map as Kathy showed. As Kathy said, the 2 largest jurisdictions in Maryland, a combined population of about 2 million, so very large counties. As Kathy said, both of these border Washington, D.C., part of the D.C. metro area, D.C. Media Market, and so on. Montgomery County is known as a very wealthy county, but as Kathy mentioned, tremendous issues with social determinants, many, many pockets of poverty and other challenges, lots of food deserts, food swamps, same with Prince George's. So, these are counties that really have a need for these types of policies addressing the food environment that, as you all know, in so many places is not what we need it to be. So again, we were focused on this, what we call a comprehensive policy addressing restaurant kids meals, going a step further than the beverages and focusing on the food as well. So we're very proud of the fact that here in our area, we have the only two, as I said, in the entire country. Prince George's was the first to pass such a policy in November of 2020. And if you go back and think what November 2020 was like, that's when restaurants were just decimated. That's what we were hearing about, all the challenges they were facing, the layoffs, going out of business. And I'll get into this in a minute, but we had such a strong legislative champion who said, I understand that, but we need to make restaurant meals healthier because of all of the issues I'm seeing in my community. So it was because I think of that strong legislative champion, we were able to make this happen really at the height of the pandemic and at the height of the challenges restaurants were facing. Earlier this year, Montgomery County followed Prince George's and passed its law in March of 2022. And both of these include a little bit longer phase-in than we'd like, given the challenges that the restaurant industry has faced and everyone is facing. But we're beginning to kind of work through and talk about implementation of how this will all look into the next year or two. So, I've talked a little bit about what these policies are all about. And, again, these are common sense policies. We are just trying to make restaurant meals healthier. Again, not preventing things from being sold, just changing the defaults. And I probably kind of glossed over the restaurant, the food piece a little bit more. Really, all that is making sure that one meal on that kids' meal menu, one bundled meal, will meet these certain national nutrition standards. So if you have, a handful of bundled kids meals, just one that limits the amount of sugar and sodium and fat and so on. You're starting with one side that would be healthier. So maybe making sure at least one menu item includes a side of, say, apple slices rather than fries, and then having one full meal as well in the years to follow that would achieve that as well. So again, to us, this is common sense. We're just trying to do pretty basic, again, that visual cue on a menu that says this is healthier, but you can still order whatever you want. But really, as you all know, and I think it's my understanding that a lot of you come from the tobacco world, and I do a lot of work in tobacco policy as well. You all know how difficult it can be going up against a behemoth like Big Tobacco, or in this case, the beverage industry, Big Soda, the restaurant associations. And that's why it's so important that we have these great legislative champions. And that really goes back to, again, what I wanted to focus on is why we focused at the local level. We know that when you are trying to do something that we think is common sense, but these big, huge billion-dollar industries think is the end of the world. You all know, and I know the work that you all do, how difficult that can be to convince whether it's the public or lawmakers that this is the right thing to do. So we knew that here in Maryland, we weren't quite ready for a state level policy. We knew that getting something like this through the General Assembly, they just weren't ready for this. They maybe saw this, as the nanny state or something that, we don't want to be telling restaurants what to do or parents what to do. But we knew that potentially we had communities in our state that maybe were ready for this and did see it and had lawmakers that really understood why this was so important. And you see on your screen, we have these incredible legislative champions. Councilmember Sidney Harrison in Prince George's County, Councilmember Craig Rice in Montgomery County. And these were just kind of the two leaders of this effort. There were many others that worked on this and supported this as well. But Councilmember Harrison, for example, he tells this incredible story of him growing up where he didn't have access to healthy food. He didn't have people in his life that understood the importance of nutrition or weren't financially able to provide him with healthy food. And he talks about all the challenges he had growing up that he's had to overcome in his adult life. And he talks about what he sees in his district with the folks that he represents and the lack of access to healthy food that they have, and how personal it is to him that more people have better access to healthy food, can better afford it, and it's being made available to them. Councilmember Rice talks about similar things. He talks about his two daughters that, again, he's able to provide whatever they need, but he knows so many of his constituents simply can't. And so for both of them, this was incredibly personal, that they were making sure that the people that lived near them, that lived in their communities, could have at least better options. And if they chose not to purchase those options, that's fine. But they wanted to have them available. So it's not just the legislative champions. Again, it's having these really authentic community voices that I'll get to in a second. Physicians that are trusted in the community, certainly faith leaders, moms and kids, and of course, those of us that work in public health. But and I know all of you know all this, but just wanted to point out particularly how important those two champions were at the local level. And I think what we found working at the local level, again, is and why we chose to work in Prince George's and Montgomery, because again, we did not think, again, the time was right to do this at the state level, but we really felt if we could make this happen at the local level, demonstrate to people that, to lawmakers at the state level, that this is what the public wants. This is what your voters want. They are craving healthier options. You might be hearing one thing from the beverage industry and the restaurant association and everyone else, but real people who live in your communities, this is what they want. This is what they care about. And then showing that we can implement this and the sky won't fall, that restaurants won't lose business, that it's not going to be a financial burden. This can work. Eventually, and then maybe we'll work in other counties and have this happen as well. We can reach a tipping point where now, now that we have Montgomery and Prince George's, that's 2 million people who live in those places. The state has, I don't know, about 6 million people who live here. So we've already a third of the population. We're getting pretty close. Why not have that state law? And so, we working at the local level, which I know many of you do, you all know this probably better than I, but it is so incredible to work in the community and have those authentic voices, because different when you're working on maybe on federal policy or state level policy, where things seem so far away and distant. This is our community though. So it's so important that if we're talking about this on social media, if we're running op-eds and letters to the editor, that these are real people that you might see at your kid's school or at church or at the grocery store, wherever it might be. And so it was so critical that we had real people telling real stories, why this mattered to them. So these are some of the social media things that we used. We didn't tell them what to do. We didn't script anything. We said, hey, we want to know why you support this. And this is what they told us. None of this is edited. None of this is changed. This is their words and their authentic voices. And we have tons more of this. I just kind of put up a couple. But again, working at that local level, again, whether it's these big, huge local places like Montgomery and Prince George's that are both about 1 million people, or a small town somewhere, again, we need to make sure that we're really representing the community and speaking with a voice, because again, we're going to see these people all over town, and we want to make sure that we're not saying or doing things that the people might think is fake or astroturf or not real. Similarly, we were fortunate enough to generate a lot of really positive media coverage about this. Although, again, the Beverage Association, Restaurant Association might have had different view on this. We had some really incredible folks, like you saw on the last slide. You probably can't see it too well, but on the right, this amazing local health champion. His name is James Tate. He has this incredible story. He lost over 200 pounds. And similarly to our legislative champions, talks about, when he was growing up, he didn't have access to healthy food. He wasn't in an environment where that was the norm and that was affordable. And as he got older and started to have some health challenges, he changed his life, and now he's a health coach, and he's an incredible speaker, and he leads health ministry at a mega church, and just all this incredible stuff. So some of these examples here are op-eds that he wrote telling his story, and now he's raising his kids that you hopefully can see in the photo, with kind of that health in mind, and he's able to provide those healthy options that he didn't have. And it's so important to him that others in his community have access to that. So again, as we focus this on our local communities and engage community members and community advocates, it was so important that this was authentic, it was real, it wasn't big organizations like mine like the American Heart Association pushing this, but it was real people telling their stories, why this was important. And working at the local level, that's been such a hallmark of what we've done in our coalitions, is to have real people like James telling their stories and leading the effort. Similarly, here's a little bit, just a few more examples of social media. But again, as I've been saying, all of this was the focus on being community-based, community-driven, community-led, having people tell their stories. And then hopefully we're going to get to the point in the next year or two where we might be able to advance this to a state level effort. But first, we think, although we have these 2 counties that are very influential and very large, the next step maybe is to look at some other counties throughout the state where they might be receptive to this after they've seen how well this was received in Montgomery and Prince George's, and move things forward. So again, here's just a little bit more example of some of the messaging that was put out there and some of the communication that was seen in the public. So just some last slides, a lot of common sense things that you all know, working at that community level, at the local level, on policy change, especially something that can be perceived as controversial, like making restaurant meals healthier. Again, the critical importance of having strong, committed legislative champions who are going to push this and fight against big industries and make things happen. I know I've said it a billion times, but I'm such a huge believer in authentic, not just community-based, but community-led coalitions and voices. As you all know from working in tobacco and similar issues, you all know what the industry can be like and how difficult that can be. So you have to make those compromises sometimes, but still honor what the community wants and make sure that we're passing a policy or implementing a policy that's reflective of what the community initially wanted and expects. Everything we do, of course, it starts with that equity first effort. And as I said at the beginning, so many neighborhoods and communities in both these counties have a lot of social determinants of health challenges and health equity challenges, and all of this was led with it from an equity first lens, for sure. So again, lots of social media and other media that we think, again, at the local level is so important, because people are seeing their neighbors, their community members, people that they might know, or people that know someone that knows them, telling their stories on social media, and then it's real. It's not just some random Facebook person or whatever. So it makes it so much more important at the local level. Of course, like tobacco, like so many other things, this stuff is absolutely not easy. We all know that, but that's what makes it so important. So there's my contact information. Certainly feel free to reach out if you have any questions. I know there's folks on here from all over the country, and although these are the only 2 comprehensive food policies at restaurants in the country here in Montgomery and Prince George's, as I've said, dozens of places around the country have done this with the beverages. So certainly I'm happy to put you in touch with any of my colleagues or others who might have worked on this in your communities if you have questions, or if your communities haven't addressed this yet and you'd like to. Again, I'm certainly happy to put you in touch with folks that would be happy to work with you on this, because it is so important and what we need now. So I will stop there and happy to answer questions when we get to that point.
All right. Well, hello, everybody. Hopefully you're not too zoomed out at this point. And I know we can't see each other, but I still want everybody to participate a little bit here. So I first just want to thank the previous speakers and thank Elizabeth and Counter Tools for inviting me to this. I worked in tobacco for a long time. Back in the old days when we were doing clean indoor air ordinances, and then have also done some work more recently with flavored tobacco bans and restrictions. And I've also then branched into doing work on sugary drinks. So Berkeley is a town of about 120,000 at this point. It is definitely a university town. It is part of the big metropolitan area of the Bay Area. You probably know all this already. The other thing about Berkeley is that it's a very progressive community, sometimes annoyingly so.
But it is often a place to push boundaries and start movements. So city council prides itself on passing ordinances that haven't been passed elsewhere before. So how many of you, I'm not going to be able to see this, so I'm just trying to engage a little bit here. How many of you have been involved in passing local ordinances at the city level, working with city councils? Okay, I'm going to guess there's a ton of hands going up.
You can put it in the chat or raise your hands.
Yeah, I mean, it's just to try to break up the talking heads a little bit here. So one of the things that's different about the Berkeley soda tax effort, in my experience, was that it was a local ballot initiative. And so the rules about this are going to be a little bit different in every state. But in California, you can't pass this as an ordinance by a local elected by a local elected body like a city council or county board of supervisors. So this was a ballot initiative, which was a little bit different. In other ways, I really pulled on my tobacco experience, and I want to echo some of the lessons that Stuart emphasized about starting at the local level, the state not being ready. So in California, when I worked on tobacco, it was following a statewide tax back in the 90s. And every county was involved in helping to pass local level no smoking in the workplace, clean indoor air ordinances. And eventually there was enough, is like the dominoes, enough dominoes fell that it tipped and the state passed it. There are stories there. I won't get into it. You probably all have your own stories about that. Oddly, some of the public health folks didn't learn that lesson when they started working around soda. And so they spent about 10, 12 years trying to move this through the state level and getting defeated over and over again. There was just too much lobbying money at the state level, too many key important groups that were being influenced. And so I and others decided that the most important thing here was to focus on the local level. So here's a picture how the Bay Area beat big soda. And here's the story and my lesson. So first of all, why a sugary drink tax? So similar to tobacco, there are serious health consequences, and these health impacts are greater in communities of color and under-resourced communities, due in large part to industry marketing and the availability of products, right? So Stuart mentioned food deserts, food swamps, areas where there's less access to big grocery stores, more access to lots of neighborhood convenience stores with lots of marketing and cheap sugary drinks. So, and also like tobacco, we've got disproportionate impact on, in this case, children of color. So why the sugary drink tax? These three girls are in, and I'll just tell you a little about this photo. They are in a community garden, a school-based garden, excuse me. And Berkeley had, for probably 20 years before we started this tax, 15, 20 years, this incredible school-based garden cooking and nutrition program. And one of the impetuses of the tax was that we lost our funding. So other reasons for the sugary drink tax, other health impacts, dental decay, diabetes, heart disease, obesity, which we don't talk about as much anymore. And then the fact that the medical costs, in addition to the human costs, that will be incurred by that. So we wanted to do something about it. So this is Berkeley's Measure D. It was in 2014. We spent about 18 months organizing and talking about it. And it was the first successful sugary drink tax passed in the country. We actually talked to the folks in Mexico who did it before us and learned some lessons from them. It's a 1 penny per ounce tax. Some of the more recent taxes are larger, which is good. As I mentioned, it was inspired by funding cuts to this popular school-based garden program. A challenge which I won't go into very much because it is pretty California specific. I'm not sure any other state has this, but we had to, there's a higher vote threshold for designated tax than a general tax. But then that triggered for us a whole discussion about accountability. If we're implementing this tax and there are tax revenues coming in, what's going to happen to that money, especially if people feel like the taxes, I'm not sure I want to go down this rabbit hole, but that I was going to say the tax is regressive, but like tobacco taxes, it's actually a tax on the industry. So technically it's not regressive. Hopefully this is all sounding familiar to you. But if not, just trust that there were people who felt like, wow, we're paying more, but what are we getting for it? And so we really felt it was important to have some accountability, but we were constrained by these California rules around how taxes can be implemented and how the money can be spent. So we built in some accountability, and Berkeley passed the model that ended up being the model, not only for California, but some other parts of the country, even when they didn't have the same conundrum, which was to write into the tax initiative a community advisory board, which in the case of California advises council on how to fund the health programs. It was the only way we could do it. But there were sort of political promises made, and we had to keep organizing people to hold council members to those political promises. In Berkeley, it's worked pretty well. In some other cities, especially the bigger cities, it hasn't worked as well. There have been more challenges with people wanting the money. We had a very broad community coalition with leadership from key constituents, including the communities of color that I mentioned. So Latinos Unidos in Berkeley, and the NAACP and some other very critical African American organizations in Berkeley, parents groups, public health doctors. And as Stuart mentioned, we won through organizing our communities and having authentic voices and leaders. Okay, so how do taxes improve health? Again, similar to tobacco, except this is happening at the local level. So for the last 4 months of the campaign before the election, I mean, we've been working on it, like I said, for 18 months, but there were billboards and there were lawn signs everywhere. And so it was really important to look at how tobacco and soda taxes can improve health. And there are sort of 3 ways that that can happen. One is that the campaigns themselves raise awareness. I remember walking down the street carrying these big lawn signs. They're like 3 by 2. It says Berkeley versus Big Soda. And this woman was on the phone behind me, and I could hear her talking to somebody saying, wow, what is that? So there was a lot of visibility and a lot of community discussion. The second way is, again, it's not a sales tax directly on consumers, but if Big Soda raised the prices, which happened in about 70% of the stores, the industry passed on that tax by raising their prices. That in itself can reduce consumption. At 1 penny an ounce, it's less noticeable than with the higher tobacco taxes, and maybe some of the cities where the sugar drink taxes are higher. And then really the most important thing is that in our case, and in the model that we started, it raised money that went into prevention programs and education programs. All right, so I've touched on a lot of this. You can see the big lawn signs and the t-shirts here. These are some of the folks that were involved in the campaign, and you know, you can see there, they've got their clipboards for canvassing. So what were some of the really important things that we did? We talked about community organizing, learning lessons from the tobacco movement. We talked about addressing the industry tactics, and I've got a slide where I'm going to go into a little bit more about that. And then another really important element of this is framing the issue. Again, you will see that there's a strong parallel there with tobacco. So here's another slide that summarizes some of the lessons that we pulled from tobacco prevention, starting local because there was no way it was going to pass at the state level, engaging your community, building a broad coalition, and including key community members in the leadership and decision-making body of that coalition is also really important. And then framing the issue. I'm going to talk a little bit about framing the issue, because that, again, is something I learned from tobacco and brought to this. I guess that's the next slide. But so I will hold that thought. This should look familiar, again, from tobacco. How we preempted big soda playbook. So we knew from experience of what both tobacco and big soda had done before. There had been a failed local attempt in a nearby city, Richmond, California. And so we learned from what happened there that big soda literally bought off churches, like paid for a roof on a prominent African-American church, sort of a way to shut them up, to be crass about it. And so we preempted that by going first to a bunch of the key groups in Berkeley and saying, this is what we're doing. This is why we encourage you to jump on board with us and not engage with the beverage industry. We talked with local businesses about what this would mean to their profits. And we met with key business leaders to gain endorsement or neutrality. We focused the measure on the big companies that market to kids, as opposed to, more local drinks, homemade drinks like lemonade or aguas frescas. We knew that big soda would start talking about grocery tax. That was a key strategy. And we tried to get there first and educate the community, and then just keep on the message of, who do you trust, big soda or your community members, your neighbors, your local doctors, etc. All right, so I think that we've talked a lot about the community organizing that we did in terms of leadership and listening to priority populations and focusing on health equity. This was one of the things that I think is really important if you're going to do some kind of ballot measure. We actually had a political consultant who was very experienced at how you win, how you get a strategy of winning, but it didn't necessarily include educating people who are going to be most targeted by the beverage companies, same folks that are targeted by the tobacco companies, folks who maybe aren't as easy to win over, or maybe don't vote as regularly. But I was very clear as a public health person that the public health win was to frame this issue around engaging communities who have those disproportionate rates of diabetes, who are disproportionately targeted by these soda companies, Coke, Pepsi, etc. And to highlight the health disparities and big soda target marketing, because we could pass the tax with a simple majority, but alienate those who are most vulnerable and who were in Berkeley and elsewhere most subject to the big soda campaign against it. And we felt it was really important to include people and make this both a tax and a public health win. All right, so this should be very familiar. I mentioned framing the issue was important, and this is something I learned from tobacco. Our country, and especially these big, powerful corporations, want us to think of this as individual responsibility. That's where that sort of nanny state message that Stuart mentioned comes from. it's up to individuals to choose what they drink. If you're a parent, you're responsible to make healthy choices for your kids. It's not the government's job. Well, and if you get sick, it's your problem because you made bad choices. Well, that lets big soda and big tobacco off the hook. It is not to say that individuals don't have some responsibility, but it's not a level playing field. When you go into a store and you're bombarded by drinks that are cheap and there's lots of marketing on TV and in the stores. And so that's where shifting the focus from it's the individual's responsibility to we have as a community the ability to change the environment that we live in. And so framing the issue by looking at the environment, what are those industry tactics? They saturate our environment, price, placement, product, marketing, and sponsorship. These are all tactics that I believe you will be familiar with. And we know that big soda is motivated by profit and does not care about health. So taxes hold these big companies responsible for the harm caused by their products. All right, so I've mentioned community organizing many times. These were the key groups that we reached out to, the constituencies that we wanted to make sure to listen to, involve in our leadership, and engage in the campaign. Communities of color, as I mentioned, schools and parents, which gets back to that garden program. I think that was one of the things that Berkeley had as a real strength. We had a program that was very popular that reached all students in the public schools, and it was facing an existential funding cut. And so this was a good solution because it was linked. You know, we were raising revenues on a product that's not good for your health to fund education for all kids in our city that choose to go, whose families send them to the public schools, to talk about food and nutrition. We are also the home to UC Berkeley, as you know, and we had students, faculty, and staff that we needed to engage who are also Berkeley voters and Berkeley influencers. So we put together something called the Soda Series, which was an educational program where we had a number of different speakers. We did some local business outreach, and there was a debate at the Chamber of Commerce in which they chose to be neutral, which was huge that they didn't come out against it. And then, of course, we had a strong role for youth. So I'm going to keep moving forward, but I want to just remind people that marketing was huge. And big soda front groups bought the BART station ads. BART stations are the rapid transit in Berkeley, Bay Area rapid transit. And so I had friends who went to work in the morning on BART and came home, and 2 of the 3 BART stations in Berkeley were plastered in these signs. I had no idea you could purchase ad space on the floor of the BART station. It was everywhere. It backfired big time on big soda. They did not do a very good job of understanding their target audience in Berkeley, because we had an outpouring of money following this. People were like, this is outrageous. I want to support you. Okay. Revenues raised. I'm not going to go into a whole lot of detail, but you can see that Berkeley has yielded probably around 1.5 million a year. These are fiscal years. The decline towards the end, maybe in part the impact of what we're doing, but I think it's also a lot about the pandemic and how that's impacted restaurants. And I mean, UC Berkeley students were off remote for a big part of 2021. And the city has invested 1.5 million average per year. It's, as I mentioned, that community commission that's appointed by city council. It's advisory. It was written into the initiative. And I've been on that commission since the start, and we've been guiding recommendations of how the city should invest the revenues. We run a request for proposals program. Half of the funding goes to this school garden program. And then the other half goes to community-based education, skills building, and nutrition aimed from Head Start preschools all the way through people who are parents. We have identified priority populations, and pretty much all the funding goes to priority populations. Those are the most targeted by Big Soda. We've also funded, as part of our community programs, dental screening and diabetes prevention for low-income folks, and some local policy efforts, which include Healthy Checkout. So I'm going to talk to you briefly about Healthy Checkout. This is an example. In 2020, Berkeley passed the first in the nation Healthy Checkout ordinance. It applies to large stores that are licensed to sell food. So mostly grocery stores, but also places like big drugstores, like out here we have Walgreens and CVS, dollar stores. The ordinance defines checkout aisles and restricts what food and beverages can be sold in the checkout aisle. So this, I know I'm moving from one thing to the other, and I'm aware of time, so I'm maybe moving a little quickly, but the sugary drink tax has been evaluated. There are a number of studies that have shown that it has really decreased sugary drink consumption in Berkeley relative to other neighboring communities. The revenues have gone to support a variety of education, prevention, skills building, and policy on medical screening programs. And the major policy program that was funded and came out of this effort was a Healthy Checkout ordinance. So I'm going to just tell you a little bit more about that. And one of the reasons I bring this up is because I think it is similar in many ways to the tobacco ordinances I have worked on, and maybe some of you are as well. Because first of all, it's a local ordinance, not a ballot initiative. And second of all, it is something that looks at the availability and marketing and placement of products, which is similar to the work that I was doing around flavored tobacco. And I think there's also parallels with alcohol and alcopops. So I thought that this would be interesting for tobacco folks because there's some similarity there. Again, why Healthy Checkout? Majority of at-home food purchases are from grocery stores. Product placement is powerful marketing, impulse buys, and we were able, in a similar way to what Stuart described with the children's healthy meal package ordinances, which are also big out here. The state now has it as well, but only on beverages. We haven't gone so far as to include food, which is exciting. We did a lot of work to engage community members, to assess where things were, and to hear from community members about what they wanted, and generate letters of support and gather petitions. We had a whole youth leadership program. They were trained to actually do a lot of this community assessment and presentations. So that when it came to the city council deciding about this, it was very clear that it was something that community members were asking for. We did talk a little with a few retailers. I just want to pull that out for a minute. Like the soda taxes and some of the tobacco ordinances, because you're up against, it's this David versus Goliath thing, because you're up against Goliath, it is important to keep things quiet as long as you can, so that you don't get industry money and counter marketing coming at you. They're always going to have more money. And so we didn't go and talk to people at Safeway or Target, the big chain stores initially, because we didn't want it going up the chain to their leadership and then getting to the soda companies or the snack companies. We talked to a few of the local retailers about how this would work, how it would benefit their customers, what it would mean for them. And we did get folks who were either neutral or supportive. It was a 3-year process. Like I said, there was a lot of youth leadership, and it culminated in a presentation to council that focused on what foods they could buy and what foods that they didn't buy. So this focuses on where food is purchased. So you can see that we looked at this and saw that large grocery stores is where a lot of calories are purchased. And because we didn't want it to, we wanted to start with something winnable, we decided to start with large stores and not include the smaller stores at this point, although there's movement to do that in other cities and potentially in Berkeley as well. So just to give you a feel for the assessments, this is what we did. I was trying to figure out, how do we define a checkout aisle? If you close your eyes and you think of a checkout aisle, you will probably think of something that looks a bit like this, that has a big conveyor belt that leads up to a cash register and has a wall of candy, etc., on either side and above the conveyor belt. But turns out there are stores that have other styles of checkout aisles. And once we got into the details of the ordinance, we had to really define that and define what that meant. And we went back and forth with some stores about how that would work. So this is just to give you an idea of the kind of assessment we did. And I involved my son in it, making him stand there. This was a local store, and you can see that the checkout aisle sort of ends at 6 feet, the end cap by 8 feet. And they were concerned that sometimes it's very busy and the lines would extend all the way beyond 11 feet into what was considered grocery aisles. So there was a lot of detail to think through about how we defined things and what products we wanted to allow to be sold and what rationale there was for that. And then, like I was trying to say, a presentation where we showed a product by, say, Coca-Cola, and then a product that happened to also be owned by Coca-Cola, but that met the criteria of having less than 5 grams of added sugar or 200 milligrams of salt. So that council members and stores could see that there were plenty of good options that they could sell in those areas, even some that are sold by these big companies. So just to cap it off, there were a lot of challenges with healthy checkout, a lot of decisions to be made. You now have the benefit of what we've done. So to the extent that that is helpful, if anybody wants to take this on, I've written a roadmap, which is published on the Center for Science in the Public Interest, CSPI, on their website. And you can kind of see our thinking, and then that can inform some of the discussions that you might have if you were doing this in your community. Something that we've learned, the implementation, it's really important to help stores to figure out what they can sell. But I think that it's important to do enough inspections that stores think you're paying attention. And I think that's something we're going to have to tighten up here in Berkeley. Another thing that I think is really important is to consider what food definitions and beverage definitions you want to have. Because currently it's a little bit broad, and that makes it more confusing. So those of you who've been involved in banning flavored tobacco products, if you've done any store education, it reminded me a lot of that, because store owners would be like, okay, this tobacco is called red. Is that a flavored tobacco? Right? So the industry is always one step ahead of us. I think the simpler it is, the better. And I'll give you an example. So stores went to the city after this was implemented and said, what about chocolate? Does chocolate count? Well, technically, chocolate is a bean, makes it a legume, which means it's allowed. That was not our intent. Don't get me wrong, I love chocolate, but the idea here was to try to keep the chocolate not at the checkout aisle. So people can intentionally go look for it, but not be marketed to or inspired to make some last minute purchase. But technically, by the requirements of this ordinance, chocolate, as long as it has less than 5 grams of added sugar per serving, is allowed. All right, so I threw a lot at you. I look forward to questions. There are some resources here. I believe you'll have access to this. So if you want to learn more, you can check those out. And you can reach out to me if you need to.
Thank you so much, Holly. Well, I have one question coming in already. I think this is for you, Holly, but I also think it applies to some of our other conversations. It's what kind of data did you use to estimate costs to businesses? Did you have any of that data to share?
You mean coming out of it?
I think this question, feel free to clarify your question, but I think the question is, how were you able to ward off concerns by businesses that they might be losing a lot of money from policies like the sugar tax or the healthy checkout? Did you have any like economic argument for why this wouldn't hurt them?
That's a good question. There have been studies, it's not on the top of my mind, but there have been studies around the soda tax that debunked the idea that stores were going to lose money, because what happens is that there are alternative drinks that people start buying. And I don't know if this is true. I know people here are here from all over the country, but out here, there's a huge proliferation of popular, this is drinks related, right? Popular flavored waters that have no added caloric or sweeteners at all. So, and again, we didn't engage very much with the big chains. We engaged mostly with the smaller stores who are local businesses. We weren't too worried that the big chains were going to figure out how to deal with this. And the feeling there was, if this is what our customers want, then we want to support that. And so they would find other snacks. And one of the concerns that was raised in a focus group was that there would be snacks in a similar price range. And so I have a whole presentation that I did for the city. So if that person is interested, I could probably share that. And it features this product that you would typically find in a checkout aisle, and then a similar product that meets the healthier requirements, similar price range. So, and in terms of the economic impact on soda taxes, I know there's stuff out there. I'm sorry, I can't. Actually, Stuart, do you know this? Is this something that Heart Association knows about?
Well, yeah, I mean, I think that you have it right. I think that a lot of it has been debunked because it's not like people are going to stop buying beverages. So if the price goes up for a sugary drink, they're still going to purchase. Well, I hope that's the idea, is they're going to purchase something else. So the store will make the same money if someone's buying, hopefully, bottled water, or like you said, something without added sweeteners or whatever else. So I think that's generally, and if you're also looking at the other end, just like as you described in Berkeley, other places as well have poured the revenue back into the community. So so that's the other side of it too, is that hopefully members of the community, particularly in under-resourced communities, will receive the benefit of whether you describe kind of the garden programs or expanding access to SNAP or whatever it might be. That revenue is going back and being reinvested into those communities.
Right.
Yeah, it sounds like that would be helpful if any of you have resources on like handling the economic arguments we get with policy. It sounds like that would be a helpful tool.
Yeah, and I can say too, like that came up in the kids meal argument too, where we all, again, along the same lines, we didn't believe there would be any additional cost because the restaurants were providing the same food and beverages that they already sell, just kind of packaging it differently. But some of the pushback we got from industry that resulted in some compromises that council members had to make was that, they said particularly, small restaurants, mom and pop restaurants, they might be buying their products from, say, Costco or Sam's or whatever it might be, So they're beholden to whatever the packaging is, say at Costco. So if we're saying that we want you to limit a juice box that would be in a kid's meal to say 6 ounces, but they're saying, oh, we can only get it at 8 ounces. That's a challenge, and that again was part of the equity argument as well, that we didn't want to in any way negatively impact small businesses, small mom and pop restaurants. We wanted to make sure that they weren't losing any money on this. That was never the intent. So because of that, and same deal, like they said, apple slices might come in a slightly smaller package than we would want it to be. We would want kids to have more of the apple slices. So that's an area where we had to make some compromises on the health side because of the economic realities. So, little things like that, but that did come up for sure.
Thank you.
One of the things I just want to add that's really different in both good ways and bad ways between tobacco and doing food policy is you've got the same, big corporations that are interested in making money and they're not as interested in health. But the benefit with food is that people do need to eat. So they're going to find alternative food and beverages. With tobacco, the goal is not to find something else for them to smoke. The goal is to stop people from accessing tobacco products at all. So I think the economic argument is pretty different. On the flip side, with tobacco, like doing the flavored tobacco work that I have done, and I'm sure many of you have done, it's a lot easier to make those arguments that they're marketing to kids because that's illegal. It's not illegal to market Pepsi and, candy bars to kids. So there's sort of two sides of that coin.
Thank you. I'm going to go ahead and pass it over to Ikra for a couple concluding statements, but if others have questions that we weren't able to get to today, please feel free to email and we'll follow up and make sure we include all the presenters' emails so that you're able to get in touch with them.
Thanks, Elizabeth. Hi, everyone. I just wanted to say a big thank you to our presenters for your wonderful presentations and for the discussion that we all had. And thank you for the webinar, to the webinar attendees for your participation. And before we wrap up, just a quick reminder that after this webinar, you'll be redirected to our brief evaluation survey, which we kindly ask you to take a quick moment to fill out. Letters of attendance will be given only upon completion of the survey. And this week, you'll receive a post-webinar email with the recording, slides, and the evaluation survey for those who may have missed it here. And on behalf of GN Counter Tools, we wanted to thank you all for joining us for our 3-part webinar series. We hope that you all were able to learn more about local policy solutions and implementation efforts and innovative local policy strategies. In case you missed the earlier webinars, the recordings are available on the GEO website, so please do check those out. Thank you again, and we hope you have a wonderful rest of your day.